Yes.
Yeah.
All horizontal. Okay, so I'm getting it from all angles. For the skull, here's what you want to know. The actual skull bones, so you're going to have the frontal, the two parietals, the occipital, so here's the occipital protuberance, and then here are the occipital condyles, right here. Then you have, this is the zygomatic maxilla. Here's the maxillary tuberosity right here. Then you have the temporal that we focused on because of the TMJ. So mastoid process, styloid process. Here's the articular fossa. Here's foramen magnum. Right here is going to be this part of the sphenoid.
Where's the occipital condyles?
Right here, occipital condyles.
Who's the greater? Can we see the greater wing and?
So for that, it's sort of hard to see here, but yeah, here's the sphenoid in here. So lateral pterygoid plate, and then in here would be the sphenoid. So you can see like the butterfly shape. Sternal end. Mandible. So we have the coronoid process, the notch, the condyle, the ramus, the branch, and then the angle. Scapula. Right away we know this is posterior because this is the scapular spine. Then we have the acromion process, infraspinous fossa, supraspinous fossa, vertebral border, axillary border, glenoid fossa, coracoid process, subscapular fossa, and I know this is a right because this is posterior and this is the lateral. This is the atlas, the cervical vertebrae because it has transverse foramen right here. The atlas is C1, it articulates with the occipital condyles. It does not have a body, so it's sort of unique. The greater tubercle is more lateral, lesser tubercle, bicipital groove, capitulum, trochlea, medial epicondyle, lateral epicondyle, lateral supracondylar ridge, olecranon fossa, the posterior surface, hip, pubis, anterior, ischium, ilium, and then bony landmarks. So we have for the pubis the superior ramus, the inferior ramus, ischial tuberosity, ischial spine, lesser sciatic notch, greater notch, posterior inferior iliac spine, posterior superior iliac spine, and so auricular surface.
How do you know it's left or right?
Yep. Acetabulum is lateral, pubis is anterior, so I know this is right. Iliac crest, obturator foramen. I think we have. This is what articulates with the L5 vertebrae, superior articular processes with their facets, posterior foramina or foramen. We already looked at the ala, and then this is the auricular surface.
What is the ala?
The ala is just this part up here. It's basically fused transverse processes. Femur, head, neck, greater trochanter, lesser trochanter, linea aspera, medial condyle, lateral condyle, medial epicondyle, lateral epicondyle, patellar surface. Pelvis includes the SI joint, sacroiliac joints, includes lumbosacral joint, which is right here, and then the pubic symphysis. So we have the pelvic inlet from the top of the sacrum to the top of the pubic symphysis is the pelvic inlet. Pelvic outlet is tip of the coccyx to the bottom of the pubic symphysis. I'm blinking. So this is a female because it has a wider pubic arch. We have the radial head, which is proximal, and it articulates with the capitulum. Radial tuberosity, styloid process. Then we have the ulnar head, ulna styloid process. We have the olecranon process, trochlear notch, and I think that's
The radial notch.
the radial notch is going to be right here on the ulna that articulates with the head of the radius. You want the carpal bones?
Mm-hmm.
Scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, hamate, metacarpal 1, 2, 3, 4, 5, proximal phalanges, middle phalanges, distal phalanges. Next, tibial plateau, medial condyle, lateral condyle, medial malleolus.
With the plateau again?
The whole thing, the whole top part.
Okay.
There is supraspinatus, infraspinatus, teres minor, teres major, triceps brachii, coracobrachialis. We're missing the biceps brachii, brachialis. For these ones, this would be the brachioradialis right here. These two would be the extensor carpi muscles. I wouldn't make you know the difference between them because this muscle model doesn't show the muscle insertions. Extensors of the fingers. Then this would be extensor carpi ulnaris right here. If we keep rotating, this is, like I had today, flexor carpi ulnaris, palmaris longus, flexor carpi radialis, pronator teres. Pronator teres, or supinator, and then this is the pronator teres right here. So supinator is more lateral, comes laterally. Pronator teres comes off more medially. And these, do you want to run over on the table? And there's like the fascia, and there's other muscles to the left, to the very, very left. We got this as that was the adductor pollicis right here. This would be the palmaris longus. Perfect, thank you. Okay, so you see how palmaris longus goes into this is the fascia, palmar fascia. These would be lumbricals in between the tendons of the flexor digitorum superficialis and flexor digitorum profundus. So deep to that are going to be the palmar interossei. And then if you go back here, this is the dorsal interossei, extensors of the fingers. But here's what you want to know. Remember the FAO? So flexor pollicis brevis, abductor pollicis brevis, and then this would be opponens pollicis, deep to those. Same deal on the pinky. Flexor digiti minimi, abductor digiti minimi, opponens digiti minimi is deep. Pectoralis major, pectoralis minor. This would be the biceps brachii, brachialis, coracobrachialis, levator scapula, supraspinatus. This is the deltoid on their own. Infraspinatus, teres minor, teres major, triceps brachii. This one is serratus anterior. And then this would be the deltoid, like that. psoas, vastus lateralis, vastus medialis. This would have been the popliteus that's cut. This is the gastra cut where it originates. This right here is going to be the PCL, posterior cruciate ligament. Can't really see the ACL on this one. LCL and MCL. And then the menisci, lateral medial menisci.